Item 4F, this is several contracts sponsored by Behavioral Health and Recovery Services.
Good afternoon, Dr. Janine Miller, Behavioral Health Director, and I am going to share some slides with you, some basic slides that just goes through the different contracts that we're looking at. Once I'm able to get on through Zoom, I'll go ahead and pull those up. Give me 1 second. So in front of you today is several contracts for especially mental health services, and I just want to remind the board that the contracts that we do are specific for specialty mental health services. And so the county's obligation, we have a contract with the state of California to provide mental health services, but it's specific to a population. We do not provide mental health services for all of the county. I know there's always confusion on that. We only provide mental health services to those that meet the criteria for specialty mental health, which we have a contract with Department of Health Care Services. It says we will provide especially mental health services to those individuals that have Medi-Cal. And then in the Welfare and Institution Codes, we have an obligation to provide special mental health services for the indigent population in addition to the Medi-Cal population. Other mental health services such as that are provided within our community, other therapy options, medication support services, are really provided through an individual's insurance plan. The managed care plan is an insurance plan, so we are considered a managed care plan. We are an insurance plan that has a specific population to serve. Just like if you had Blue Cross, you would go through your provider to access those mental health services. So if you're looking for mental health services and you have private insurance, we recommend that you work with your private insurance company. If you have Medi-Cal and you are on what they would call the mild to moderate spectrum, which is probably about 75% if you take with the private insurance that are accessing services, then you would access Beacon through Partnership Health Plan, and then we provide specialty mental health services. The average clientele, when they really look at state system, county systems, they're across the state, they say about 5 to 10% of your population will access the specialty mental health system of care. So that's pretty consistent when they look at counties and when they really look at that access and that population who needs that level of care. So it's the highest level of care, and it is based on, through the state, based on medical necessity and then access criteria. So in front of you, we have our contracts that make up our specialty mental health services in addition to the county services that the county provides. We're not focusing on the county services so much today, but we are focusing on the contracts that will be in front of you today. Really quickly, there was a change. Redwood Quality Management Company has been our ASO since 2013. For the first 3 years, they really focused on the children's system of care as an ASO, and then in 2016, when Ortner left, they became the ASO for the full system of care. They are making a name change as of July 1st. So as of July 1st, they will no longer be Redwood Quality Management Company, but will be known as Anchor Health Management. This year, we're doing something very different with our contracts than we've done in the last several years when it comes to the ASO and the contractors. We are bringing those contracts in-house, which means we will still have an ASO. The ASO will still perform the function they've been performing, but the county will hold the subcontractors contracts now. And so we will have contracts in-house, which will give the county the ability to have those contracts, make sure that we have everything we need for audit purposes, and the ability to have one general ledger for when the state does our cost report audits. It'll all be within one general ledger, so we'll be able to really track that and show how our funds went and where the dollars were spent should they need them, and ask for additional information when we do our cost report audits. So what you will see for our ASO this year is you're going to see a total contract amount of $3,257,000. That makes up two things. One is the ASO fee of $1.2 million, and then our hospitalizations, our physician fees, and our youth fees are going to stay with the ASO. That means that anytime we hospitalize someone in a psychiatric health facility, they have to pay that fee and have to have contracts with those facilities. We also get physician fees. Some of the facilities, the physicians require an extra fee, so not only are you paying for the hospitalization cost, there are physician fees that go with that. And then obviously our youth placement, so foster care youth that end up in different levels of care that need that mental health services end up in that system. This contract is not in front of you today, but I did want to explain how the system is changing and why it's important to see how those contracts are going to roll out. We are still working with County Council on this contract, and that contract will hopefully come to you in early July. So you'll be seeing that Anchor Health Management contract soon. The next contract that I want to talk about is Anchor Health Management. They do our medication support services. They have been doing those for several years. They do all medication management for our special mental health population, from children through adults to older adults. You can see how many the average clients they've served today. This is an unduplicated cost. This year they have served to date 796 individuals. And we estimate in their next contract that they will to serve about 650 to 800 individuals. The next contract we're looking at is McCaben. McCaben provides special mental health services for our population. So they do a variety of working with our clients in the behavioral health court, doing full service partnerships through our Mental Health Services Act funds, obviously providing special mental health services, the full array of special mental health services for our 18 and above. And they also operate a drop-in center in Ukiah. For special mental health, this year they have served 70 individuals to date, and we are projecting for their contract next year to continue, looking at them to serve about 77 to 150 individuals. And you can see their contract amount broken down by both their MHSA, their drop-in center, and then their special mental health services. Next is Mendocino Coast Hospitality Center, and they provide behavioral health court support also to our clientele. They also provide full service partnerships through our Mental Health Services Act, especially mental health services for our 18 and above, and they operate a wellness center in Fort Bragg. You can see with their numbers, they've served 106 individuals this year, and we hope to see them serve about 150 to 200 next year. And you can see a breakdown of their contract from both how much they get for their Wellness Center and Mental Health Services Act, and then providing their special mental health services. Mendocino County Youth Project is one of our children's systems, and they really focus on our children's and our transitional age youth. They provide full service partnerships for our children, transitional age youth, do the full array of special mental health services when you look at our children's and our transitional age youth population. They also do an MHSA prevention, early intervention, breaking the silence program. They have served 144 individuals through our special mental health system. When we just look at special mental health, and we're hoping to see next year about 150 to 250 individuals are served through this contract. Redwood Community Services is our biggest contractor. They provide the most array of services, more than any of our other providers. They also serve our most highest level needs of clients. They provide adult residential, both for our assisted outpatient treatment program, also known as Laura's Law, our LPS conservatorship program, and other housing, and we do have other housing within the community. They participate in our behavioral health court. They provide all of our crisis services in Mendocino County. They are part of our full service partnership program through our Mental Health Services Act. They do interpersonal skills training center. They provide special mental health for the full array of individuals, children, transitional age youth, adults, and older adults. They do our therapeutic behavioral services. They also offer transitional age youth supportive housing, youth residential treatment, and youth resource center. The youth short-term residential, they do provide for our foster care youth and other counties' foster care youth a place for foster care youth needing placement when they're pulled from their homes, and also needing mental health services. And they do serve some of the highest need kids throughout the state. So you can see Redwood's numbers. They provide a variety of services, so you can see their numbers, both their special mental health youth. They've served 275 youth to date. Transitional age youth, 157. Special mental health adults, that includes adults and older adults, 250 individuals. And within crisis, they've served 828. We are assuming they'll serve about the same or a little bit more next year. And that kind of makes up their whole account. And you can see what they've served both in their Mental Health Services Act fund and what we're asking for their contract this year. Tapestry Family Services has been one of our children's system of care, and they this year are taking on especially mental health from the adult perspective, As a lot of people know, Manzanita Services is closing their doors. They closed their doors to special mental health Medi-Cal billing as of May 15th. And those services transferred over to Tapestry Family Services. And so Tapestry has stepped up to take on that adult population that Manzanita was serving. The Manzanita Wellness Centers are currently under an RFP. That RFP should be released within the next week or so. And then Manzanita has agreed to stay operational until December this year in hopes that we can get the RFP done and transition to a new provider before they close in December 2022. Tapestry is offering now also supporting behavioral health court. They do cultural specific outreach and services to our Latino and Native American communities. They participate in our full service partnerships. They've expanded from just doing special mental health with our children and our TAE to also include our adults. They do offer TBS and are doing some youth short-term residential therapeutic programs. You can see that this fiscal year to date, they have served 134 youth and 29 transitional age youth, and of course are building their adult system right now. And you can see that we are projecting what we project them to spend for the next year, and then kind of what their contract is built on by both Mental Health Services Act and Specialty Mental Health Services. I wanted to note just a couple things. When we look at these contracts, we're really that people always get very confused with mental health finances. There's an assumption that the contractor gets whatever is in their contract amount. So if we take Tapestry, for example, and we look at their contract, the only part of their contract that's guaranteed is that $60,000 in Mental Health Services Act. The other part is a billable service. They have to provide a service to get a reimbursement. The state pays 60% of that reimbursement. The county pays 40% of that reimbursement. And that's a give or take. It can rotate up to 50% up to 68%. But on an average, what we see is about a 61%, 39%. But we look at it as a 60-40. So when we really look at the overall contracts that we contract out, we're looking at the realignment dollars that come from the county to these service providers is about $7,600,000 to make up all of those contracts. The remaining dollars, minus the MHSA, so the $12 million additional dollars has to be a service they provide that Medi-Cal approves and pays for. And I know we always hear you give them $20 million. We don't give them $20 million. We give them about $7,600,000. They make up the rest by providing a service. We bill the state, and then we reimburse them for that service. So that is how the money comes down, and that's how you bill Medi-Cal for special mental health and the match that we get from the federal, which is your federal financial participation. We also looked this year at really looking at our relative values to make sure that our contractors are able to justify their rates per minute. Really important to look at that based on their cost and the rates they're billing and the services they're providing. We also looked at what is the average cost per beneficiary, and the state says that Mendocino County's average cost for beneficiary is $7,352. The state's average cost per beneficiary is $7,155. So you can see that our average cost per beneficiary is not that far off of the state or other small county when you look at small county numbers. And so we really looked at our providers as a whole, and based on when we looked at our providers, the majority of our providers are actually providing less than that cost per beneficiary. So we're serving more people than we would if we were meeting the state standards. And so we continue to work with our providers to make sure we stay within that estimate, that we're providing services that are meeting our clients' needs, and that we are making sure that the productivity from our providers are at the level it needs to be to get the best, bring the services and get that full FFP reimbursement. The providers are here today. If anybody has questions, they are available and happy to answer questions about their services and their programs. And then lastly, I wanted to just note, we do 2 performance improvement projects every year. We're required to have a clinical and a non-clinical project. It's required by the state of California as part of our process. And we have been working with the ad hoc Board of Supervisors on outcome measurement tools and what that looks like across our system. And while we did look at a lot of data that we bring in, we've decided that one of the things we'd really like to do is take this next year's PIP, our non-clinical PIP, and focus on creating an outcome measurement tool specifically for Mendocino County. What we have found is we do have a tool, but no other county uses that tool, or if they use it, there's not consistent data across the state of California. So we're looking to work with our external quality review organization organization and really develop a tool that really focuses on our population that we can bring back to the board and then have consistent data reported every year based off that tool. And I'm happy to answer any questions.